Hey, welcome. Today, we're going to tackle something that can feel, well, a little intimidating, the whole process of HIV testing. It might seem complicated, but we're going to break it all down, the science, the actual steps, and what it all really means. Because at the end of the day, having a clear, reliable process is what turns fear into empowerment.
So let's just start with the biggest question of all, right? The one that a lot of us think about. Do I need to know my status? We hear slogans like know your status all the time, but behind that simple phrase is a huge personal decision, and it's packed with emotion.
And that really is the heart of the matter. Public health campaigns are great for encouraging testing, but it's so important to remember that nobody should ever feel pressured. The choice to get tested is yours and yours alone.
Okay, so to get our heads around how testing actually works, let's use a simple metaphor. Imagine you're out in the wild, and you want to know if a certain animal is nearby. There are basically two ways you could find out for sure.
You could look for the animal's tracks, its spoor, right? Or you could just look for the animal itself. And believe it or not, HIV tests work in pretty much the exact same way. Some tests are designed to find the body's reaction to the virus. That's the spore, what we call antibodies. And other tests, they're designed to find the actual virus, the animal, directly.
So let's break down what that means in practice. The antibody tests, the spore tests, are what most of us know as rapid tests. They're cheaper, which is great, but they have a longer window period. We'll get to that in a second. The viral tests, the animal tests, can spot an infection much sooner. But they're more expensive, so they tend to be used in very specific cases, like for early detection or for diagnosing newborns.
So that brings us to this really crucial idea, the window period. What is it? Well, it's basically the lag time between when a person gets infected and when their body makes enough antibodies, enough spore, for a test to actually find them. This is so important because it's why a test taken too soon might come back negative, even if the person has the virus and can pass it on.
So, with these two types of tests, how does it all work in a real-world clinic? Let's walk through the official, step-by-step process. They call it an algorithm that's used for adolescents and adults in South Africa.
It all starts with information and, of course, consent. If that first rapid spore test is negative, that's a clear result. The next step is really important, though: post-test counseling. That's where someone explains the window period and talks about how to reduce risk. For some people, like pregnant women, they might recommend another test later on just to be absolutely sure.
But what happens if that first test comes back positive? Well, this is where the system's built-in checks and balances kick in. To make absolutely sure, a second, different kind of rapid test is done right then and there. If that one's also positive, then the result is confirmed. Now, what if they conflict? Say one is positive and one is negative. Then a blood sample is sent off to a lab for a super-sensitive test. It just shows you how focused the system is on getting it right. It's all about delivering a certain, accurate result. And, this is the most important part, getting someone onto a clear path for care and treatment right away.
Now, when it comes to kids, things get a little different. Testing children, especially babies, isn't quite as simple. It actually requires a whole other strategy, and there's a really interesting biological reason for it.
Here's the thing. During pregnancy, a mom passes her antibodies to her baby, which is amazing. It protects them after they're born. But if a mother is living with HIV, her HIV antibodies will also be in her baby's blood, and they can stick around for up to 18 months. So a rapid test, which looks for that antibody spore, would come back positive, even if the baby doesn't have the virus at all.
So, for babies under 18 months, you have to skip the spore and go straight for the animal. Doctors use a special test called a PCR test, which looks for the virus itself. If a baby tests positive, treatment starts immediately while a second test confirms it. It's all about giving that child the absolute best possible start in life.
Okay, so what about after 18 months? By then, the mother's antibodies have naturally faded away. So at this point, the testing process can safely switch back to the same one we use for adults. It starts with a rapid antibody test and follows all the same steps to confirm the result.
Look, all these algorithms and protocols can sound a bit dry and medical. I get it. But the impact they have on people's lives is just massive. And to really understand why this matters so much, we have to take a look at what testing used to be like before we had these clear, private systems in place.
This quote, wow, it's from a man named Sizway, and he's remembering what it was like when mobile testing first came to his village. He talks about how you could literally figure out who was positive and who was negative just by watching how long they were in the counseling tent. Think about that. Your status wasn't private medical info, it was a public judgment. and it often led to so much shame and isolation.
And this is exactly why today's algorithms are so powerful. Sizway's story is one of public fear and shame. The process today is built on the complete opposite of that. It's about confidential, one-on-one counseling, double-checking results to be absolutely sure, and having a clear, supportive plan for what comes next. It's all about prioritizing a person's dignity and privacy.
So, when you get right down to it, a clear, reliable, and confidential testing process does so much more than just give a diagnosis. It puts control back into the hands of the individual. It transforms a moment that could be filled with fear into a moment of knowledge, a moment of empowerment.
And that kind of leaves us with one final thought to chew on. We've looked at the medical steps, and we've heard the human stories. So as we close out, just think about this. How can something as seemingly simple as a well-designed step-by-step procedure fundamentally change how a whole society deals with a disease, turning that widespread public fear into real personal empowerment? Thanks for tuning in.